Hi, my name is Chris Cinnamon. I'm the Tai Chi and Qigong instructor at Enso Martial Arts here in downtown Chicago. As you can see, I'm crutching around today, and I'll get to why I'm crutching around in just a moment. The purpose of this video is to demonstrate for you the application of Tai Chi movements and Tai Chi movement principles for rehabilitation of knee surgery, in this case, mine. Now, some background on that. About 4 years ago, I sustained a lateral meniscus tear, it's a cartilage tear in the knee, fairly common athletic injury. I managed it through a variety of means, being very active. But at a point, several months ago, it began to be an increasing source of discomfort and began to limit my activity. So that I thought, after that, I consulted with the surgeon, and we decided for that option. The surgery was Friday. Today is Monday, 3 days later. I began the movements I am going to show you momentarily on Saturday, the day after surgery. Since coming out of anesthesia, I have been pain-free, no pain medication, no discomfort of any sort. The joint is bearing a small but increasing amount of weight over the past 3 days. It has a small but increasing range of motion over the past 3 days. From a Qigong perspective, I can move energy up and down the limb clearly, and I can pulse the inside of the knee joint, and all of which are signs to me, at least for my body, that I'm on the road toward a successful outcome. And that was the point of going through the procedure. Now, the movements and movement principles that I will demonstrate and discuss are as taught by Master Bruce Francis, my main Tai Chi and Qigong teacher. And I want to offer my thanks to Bruce for sharing these tools and teaching us how to apply them in our lives and as instructors to disseminate them to others, in hopes that these are tools that you can find useful in maintaining or restoring your own health. Now, a disclaimer, I'm not a physical therapist, I am not a physician, I'm not a Chinese doctor. I'm a Tai Chi and Qigong instructor, and this is my rehab for my body, very specifically adapted for my situation based on my experience and what I feel. To the extent this is useful for you, if you are rehabbing an injury under proper medical supervision, then I hope that happens. All right, first, the two Tai Chi principles that I apply in adapting these movements for rehabilitation are this. The first is what we call the 70% rule. And the 70% rule holds this, that in Tai Chi and Qigong, we do no movement or no practice greater than 70% of our maximum. So if we're full up and we're extending our arms, here's 100%, and you can probably see the tension in my shoulders there. Here's 70%. My shoulders can soften and relax. So if I'm doing a movement where I extend my arms, 70%. Now that's when you're healthy. When you're injured or ill, then you back way off of that. And where your 100% may be the onset of pain, and then you back off from there, not just to 70, but maybe to 50, 40, 30, so that you can do the movements, however small, within a comfortable range, a range that does not induce significant pain. And kind of the physiological purpose of that is with pain comes tension. With tension comes tight tissue. With tight tissue comes decreased circulation of fluids. And what heals our body includes the circulation of fluids in the injured area. And that's blood, lymph, interstitial fluid, inside a joint synovial fluid. And by moving in a way where you can maintain relaxation, you can enhance rather than restrict the flow of those healing fluids. So that's the technology, if you will. And then the second principle is the injured area will be the leader of the movement. Put another way, even though you can move with a good part of the body 50% more than you can move the part that's injured, you don't. You align the movements of the uninjured parts of the body with the movements of the injured part of the body. And the Chinese medicine rationale for that is you want to bring healing energy into the part of the body that's injured, and you don't do that when you're moving that energy to parts of the body that aren't injured. And also it leads to more balanced movement, and as you'll see, a lot more smaller movement too. So we've got the 70% rule, and we've got the injured part being the leader of the movements. So the movement set I'm going to demonstrate is one that Bruce teaches called Tai Chi Circling Hands. It's an outstanding foundational set for a Tai Chi practitioner. It's also a great Tai Chi and Qigong set in itself, combining shifting of the weight, turning the hips, a variety of circular movements of the arms, all the fundamental stuff we do in Tai Chi, and some clear Chi flow patterns that can help promote the balance and strengthening and development of your internal energy. All right? So first, I'll get up. And I get up, and I'm on my uninjured leg, all right? And then I settle into what we call a neutral posture. And that's a comfortable posture over my feet. And right now it's not neutral because I'm heavily weighted on the good side. And while I do that, I establish some basic biomechanical alignments, the objective of which is that my weight flows cleanly in a line down through my torso, pelvis, legs, evenly into my foot, rather than cocking out a hip that would put some uneven pressure in the hip joint. I align that and go neutral over my weighted leg. Now from there, I can begin to feed weight into the injured leg. I'm testing it. And by feeding weight, I'm doing it very gradually, and I'm feeling how the joint responds to each incremental addition of weight. Bit by bit, I feed in weight to the injured leg until it tells me enough. And if you do it gradually and you really feel into the joint, before it sends you a pain signal, it will send you a little signal that, this is starting to be too much. And that's where I back off. I don't need to establish where it's going to hurt, all right? In that way, I can stay out of the pain area and keep it more or less relaxed without the tension that pain will induce. And so now I know, okay, I'm probably 20-25% weighted on this side, and that's up from about 10 to 15% the day after surgery. And now I begin to move. And the first circle is a vertical circle with my feet parallel. And I have a little movement in the pelvis area, what the Chinese call the qua. So a little squat in there, and what happens in the knee joint is the femur rotates back, so I'm testing a little range of motion, but without putting any pressure into the joint like I would if I were doing a front squat. And I'm feeling my feet, feeling how this pressure feeds down to them, and it feels okay. Now, it's not a big move. because I'm having the injured joint lead this move. And when I'm healthy, I can go a lot deeper in my knees. I can squat in my quad a lot deeper, and that can make my circle a lot bigger. But that's not what I'm after. I'm after motion in an injured area that does not hurt it. Now I change directions. That does not induce the tension that pain does, but at the same time gets it moving, promoting the circulation of blood, synovial fluid, lymph, interstitial fluid, all that stuff that's going to help it heal. And I'm also working on my nervous system, reconnecting through a joint that was at least moderately traumatized through the procedure, feeling my feet, and getting ready to walk. So there's my vertical circles, feet parallel, and now I go back to neutral. And I check in. How's my knee feeling? It's okay. I'll try something else. If it were telling me that's enough, then I'd sit down. Now the next circle in circling hands is a vertical circle with a weight shift. So I'm going to take a stance. And as you'll see, I'm going to take a very small stance. And I know from my experience over the past few days that I can shift my weight back even less. So I'm going to start there. I'm going to move my leg back slightly. And now this is not going to be a 100% weight shift by any means. This is going to be just a little pressure back. And my knees tell me that's about enough. And then I begin to circle. Here's a little pressure forward. Little pressure back, not too much. Note the circle's pretty small. But now I'm getting a little more of the legs in the game. A little more ankle movement. All that helps with venous return from the legs, helping circulation there. A real concern after leg surgery. And I'm feeling the pressure in my injured leg as I shift the weight back and moderating that pressure to keep within a comfortable range. And this is not a big movement. When I do this with 100% weight shift, and I will, at the end of this video, I will post a link to a video of a set of circling hands where I'm not injured, and you'll see the movements are very different. In some respects, they're bigger. So, I've shifted my weight back and forth, and now to balance it out, I'll bring this foot forward. Shift my weight back, and now I'll bring some pressure forward and back, forward, back as I circle. So far, so good. And then smoothly back to neutral, and I check in. My knee says, let's continue. So now, the next move is a vertical circle with the weight shift, and it adds a hip turn. So now we've got rotation of the pelvis, we've got turning, twisting of soft tissue in the leg. And a big concern is putting torque into the knee. That's a concern with a healthy knee, and that is an extra concern with a knee that's injured. So a couple things. The 70% rule says I'm going to dial my turn and way back. If I do a degree in either direction off a center line, that's fine. And I'm also going to be extra cognizant of my knee alignments, keeping my knee over my feet, not allowing it to collapse in or out. That will also help maintain a clean line of weight through my knee into my foot. So again, I'll move my foot back a little bit. Here I shift my weight back, and now I'm going to turn my hips, but not very much. And as I turn, I'm going to fold into this area called the quad. And by the way, compressing the biggest collection of lymph nodes in the body and the big femoral vein, helping those systems work. And then here I turn. And on the good leg, I'm going to turn the same amount that I turn over the injured leg. I'm going to add a little bit of a weight shift, a little turn. But I take it real easy on this one. Then I change directions. Now, I don't think there's much of a weight shift going on, and there's a very little turn. But for me, in my condition right now, that's staying within a comfortable range of motion. And it's also working the tissue in the legs and the pelvis and lower back differently than the other two circles. It's getting the benefit of that. Now I switch stances. Back of my circle, a little turn of the hips, little pressure forward, little turn of the hips, keeping it very small. And at this range of motion, the knee's fine. If I were to add more weight shift or more hip turn, it would probably not be fine. So I'm right where I want to be. Come to the back of my circle, I change directions. Back to neutral. And I check in. I mean, he feels okay. So to continue on with the set, there is a set of horizontal circles. Also with the weight shift and hip turn. There's a set of coronal circles with the feet parallel. And with the weight shift and the hip turn. And as I practice, I do a full set that includes all those circles. For the purposes of this video, I'll stay with the vertical circles I've demonstrated. So that concludes this demonstration of how I've adapted Tai Chi movements and Tai Chi movement principles to one instance of rehabilitation of, after knee surgery, my own. But starting the day after, I have been doing these movements, and so far, so good. Thanks for your attention. Have a good day.